After probably 45 years, I really found my purpose, and my purpose is people. The first is the center humanistic culture focus. No, we really care about people.
Welcome to Keep IT Healthy podcast, a show hosted by people making things happen in technology, aiming to optimize healthcare delivery, health, well-being, and fitness. My name is Jan Kamiński and I'm the co-founder of AppLover, a company dedicated to improving the quality of life with IT solutions and digital advisory. We started making this podcast to amplify great thinking to propel healthcare forward. Our guest today is Jaime Cervantes, founder of Liderálity. Hi,
Hello, Jan. How are you?
I'm
Good
great.
afternoon there. Good morning here in Mexico. It's very nice that you having me here. Thank you very much for receiving me.
Can you walk us through your career journey from Vitalmex to founding Liderality and this path?
Yes, of course. Thank you for asking that. Well, my career is it's I am second generation of a family business. You name it already. The name is Beetlemex, and I born there. I was there since I remember. I don't know. I don't know myself without Vitalmex right now. No, Vitalmex is it's a platform that help us, me and my brothers, to grow. Of course, my fathers to realize their purpose. Well, it's a very well known company in the market here in Mexico. One of the leaders in terms of healthcare treatments, surgery, most of them, and well, I was there working for approximately 22 years, 15 years being CEO. I am an ex former CEO of Vitalmex. We decided to institutionalize the company and having a professional management there. And because of that, well, I am trying to follow and to follow my purpose. That is the teaching, the human development, and people is my vocation. Yeah, and then because of that, I create a program that we call humanistic leadership, and that program converted to Liderality, that it's a school business, school of leadership, and well, that's why we are starting with this. It's a new perspective, a new paradigm of how we can use the leadership to create wealth, welfare, and social common good. No, and in terms of studies, well, I studied of everything, a lot of business things. No, but well, I am a graphic designer. Base that my bachelor, and after that, I studied a lot of diplomas, a big a big program of high management, and then I studied a master degree in Spain that is executive leadership, and then another master that is human development, and now I am studying the PhD in human development. Then, if you see, after probably 45 years, I really found my purpose, and my purpose is people. That's why I am very focused in that. Thank you.
And you mentioned a lot of topics, but maybe we'll start with Vitalmex. And obviously you have a long story with the company, but could you tell us more about its main products and like what it sells, and also your most significant contributions to the company?
Yeah. Okay. Well, Beetlemix, as I mentioned, is a family-owned business. Now we have a partner that is a fund that come from United States. That the name is Australis. Then we already have the 60% of the company, and the fund has the 40% of the company. And well, you know that healthcare is a right, a human right, and also as a human right in every country. These kind of countries: Mexico, Brazil, Greek. Poland, Turkey, I don't know, Peru, Colombia, and all Africans, even India. The healthcare requirements and the demand of services, good quality services, is very, 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 very high. Then the purpose of VitalMex, it's in two ways. The first one is that VitalMex is a platform to develop people. No, the pretext is healthcare, but the second purpose is that the patient is in the center, and we really mean it. No, as you see, you asked me what was my contribution in VitalMex. Well, I am a human development developer. Then the idea to have a patient centered strategy was very philosophical. No, Uh, first the patient is a human being, and they have the right to live very well, no, with the better conditions possible. Then my father started the company as a common distributor. We had a lot of representations that we buy and sell in Mexico the first 22 years. But he started doing some you know, I will use the analogy as a puzzle. No, then we have another piece, and then we started to do service, and then we started to do research and development. We developed here in Mexico oxygenators for cardiac surgery, and all the tubing sets. Also, we are manufacturing there since then, since 46 years ago. And then my father created the idea to, well, what if we really try to fulfill the requirements of the patient, the surgeons, and the nurses in one time? And we created in 1999. The company started in 1976, and then that period was a common distributor. But in 1999, we sold the 60% of the company to Cope Laboratories and Gambro, that it's a Sweden company. And when we reduce our scope only for surgery, then with that money, well, my father, my brother, and all another persons that are there created a concept that we call integrated services. That's the main product VitalMix now. 30 years ago, we developed the integrated services. That means that the Social Security in Mexico never buy bought again a product. They bought a surgery per patient, no? A pay per patient, pay per procedure, effectively realize it before. Then everything that the patient requires in that moment should be there. Then we developed another logistic strategy that is the last mile of logistic, that we imagine that our people, technicians that we have in every surgery room as a Uber, no, at every surgery room we deliver the number of items that the surgery requires, the surgeon requires to attend that patient with the best quality possible. I don't know. It's a very abstract concept, but I don't know if it's clear for you. Yeah.
I'm curious about what was the key to the company growth in Mexico and then after internationally. What's your take on that?
Well, I can tell that we have a triangle. I call it the virtuous triangle. No, the first is the center humanistic culture focus. No, we really care about people, and well, the patients it's people. Patients are people. Then the knowledge that we have to have the information in our hands, in our table, to take decisions, to deliver the best quality service possible to the patients, the doctors, and the nurses. I think that's the main point: knowledge. The second, it's our relationships. We have wonderful relationships for many years in our field. And when I say relationships, well, I am talking a lot. I'm talking about many stakeholders, key vendors, key suppliers, um, key opinion leaders. I mean, the way the way how we related with everyone, it's I cannot say that it's a win-win situation, but it's a very good negotiation between each other. um, I give you an idea. I have a vendor that they were in 20 years ago, they were resistance to the channel, because if you see the concept, Vitalmex now is a channel. We don't sell product, we use them. We use the products. Then for the vendors, Vitalmex is a channel. It's not anymore the social security. Or then as a channel, they were resisted to do business with us. Well, when they finally decide to do that, well, we have a grow for them exponentially of their sales every year, never stop. No, then the key issue is the model in see, the how we related, how we create value for everyone, not only for Vitalmex. We create value in human factor for people, for patients, for doctors, for nurses. We train them, we care them, we really worry about their wealth. The other issue is that we create value in terms of innovation. No, the chain of value, it's completely full integrated. Now, like an Amazon of healthcare, from the A to the Z. I am giving some announcements and advertising for them, but well, it's something similar. When somebody calls us and say, "Well, I need an stent," we have the stent. Well, I need a cannula. Well, we have the cannula. No, I need a suture of these millimeters and these characters. We have the suture. If they need a knife, we have the knife. If they need a retractor, the retractor. If they need a lamp, we have the lamp. If they need the loops, we have the loop. Every time, everything on time for the surgery. Then the multi-branding, it's another concept that the chain of supply is full integrated. And then there is a lot of backstage information system. No, we were the first distributor, well, the first company in Mexico that implements SAP for HANA in 5 months in healthcare. No?
How does Vitalmex decide which areas of healthcare to focus on now?
That's a great question. Well, as I mentioned, we started with 50 representations and we reduced it to surgery. Then our main four focus target markets are open surgery, minimal invasive surgery, and high specialty surgery. And we are starting to developing um, uh, specialized sterilization programs for critic areas, because well, it's a bottle of neck. If you see our model, we need to produce surgeries and more surgeries to give the population the accessibility, the opportunity, and the disponibility of quality attention. Then because of that, it's very important to have everything on time. And well, if sterilization stop the process, we lose the opportunity to attend a patient, and of course we lose the possibility to invoice. Then we are developing a new product that is sterilization in critic areas.
What is your strategy for expanding into those high complexity surgeries like neurosurgery and hemodynamic surgery, or the ones you mentioned?
Well, the strategy is the same one. Of course, the economic scales are the economics of scale. Scales of economics are very important for us. We need volume to produce earns for the governments. Then, if we have volume, we can manage the cost, we can manage the delivery, we can manage the technique, and we also can manage the mix of products. That are completely subordinated to the well condition of the patient. Then our strategy is that we have a great technology platform of statistics. We have a wonderful strategy of costing. We have a extraordinary specialists specialists, people that design solutions for each new procedure that we introduce in our contracts. And well, because of that, the knowledge, of course, and the quality of service maintain us in the market. We resign, or how say in English, we resign our contracts every 3 years for 46 years ago. Then we have a 98% of hit rate of renovation contracts. Why? Because of that service, technology, people, technology, and knowledge at the same time.
And how patient centric Vitalmex was and how it is today.
Let me give you some statistics. We are producing in Mexico and US around 700,000 surgeries per year. The only surgeries that we decided by vocation not to go inside of was trauma, osteosynthesis, and orthoprothesis. They are very, very difficult markets for us, and it's very complex to manage the inventory. But all others, elective procedures, are in our portfolio of surgeries. Then, if we scale that numbers, we can say that probably in 30 years we have been benefit 25 million people around. Now, then, the center patient focus, the center patient philosophy is our purpose. Now that we have four values: integrity, humanity, collaboration, and welfare. Now, then, if in our business we cannot fulfill these values and give this welfare or wellness for the people, um, in, we say no, no, we pass. No, then it's a philosophical idea, no.
In your opinion, how can the healthcare industry in LATAM increase coverage of specialized surgeries in general?
They need to. There is some things that we need to do in terms of public policies. No, we need to change some paradigms. For example, in some cases, I will tell Colombia. Colombia is doing a very great job with a model that is a capitation program, pay per annual patient service. Okay, and the issue is that managing the cost, they are not articulated. Then our idea is to replicate this model of business everywhere. Then we started with USA and with Gimme in Germany. And well, you will say, why USA? Well, we already travel a lot for Latin America. I was in Colombia, in Peru, in Chile, in Argentina, also in Guatemala. We established some subsidiaries there, but we failed because we didn't know that the local strategy should be a point. No, then it was very arrogant, trying to be there without help for a local. Then the first thing is try to work with that local guy, and how say show them the benefits of our articulated model business, and then get their get them advice how to do that in their country. And of course, there are some issues that we need to fix. Well, public policies, regulatory issues, and then change the paradigm of the managers that are working at that moment in that government. And well, it's knocking the door and talk about our benefits all the time. Probably doing some pilot programs, bringing them to Mexico to see how articulated services reduce the cost of healthcare. And well, we are very close to do that. We are very close to do that in USA, and it's working. No, we are not turnaround.
But okay, but for example, how does your system increase efficiency and cost effectiveness in the healthcare industry?
When you put the patient in the center, and you understand that the factor of use of the goods that are required inside of the surgery it's a big data information. We have 30 years of information in terms of any kind of surgery that I mentioned. Then the idea is to the reduce the items that are required of in a patient that are not really necessary. I give you an example. Um, 10 years ago or 15 years ago, we had a factor of use of 3.5 stents per patient per procedure. No, with us now, the factor of use is 1.7 stents per patient per procedure. How we do that? Because we know that in some cases we use 5 stents, in some cases it's only require one. But we need to train the doctors to how say increase the abilities in their techniques. We train our people to have the stents available. Imagine the managing of the inventory. We have one patient. We need to have the complete sizes of everything to that patient, but they will use only one. But if they don't have it, they will improvise and they will use one or two to fill the gap. No, with us there is no gap in terms of products. Then we use the woods in a proper way. We use the woods in a quantity that is really required. We know the etiology and the statistics of the patient, and then we propose, not historically, we propose a model of of inventory planning and delivery every 24 hours to reduce in between 25 and 42% of the expenses of the state in in the coverage. Of course, the state says, "Well, I am spending more money." Well, that's your obligation. If you reduce 42% of the cost in woods, well, use it in patients. You need to pay for the patients. Then, but you were planning in the historical way, but you plan with the budget based, not with the theology of the real demand that is needed in the country. Then I don't know if I answer.
Yeah, yeah, no, that's but let's come back for a second because you were talking about the articulated service model, and for our audience, could you expand and explain on how this model works, so articulated service model works, how it works in general, and its advantages over the integral model?
The articulation, it's an art. No, we articulated knowledge, we articulate elements, we articulate woods, we articulate also people. For example, there are some surgeries like transplant that there in Tabasco, that is a little state of Mexico. There are no doctors trained to do transplants. Then we deliver also a team of transplant treatment with ICU team, no, and that it's articulated in the paper procedure. Then there is no excuse to attend that patients in Tabasco or in Chiapas, that are very poor states in Mexico. If they contract us with everything included. Then the articulation is what are the elements that the patients require to be attended, and that's the change of this, the change in the mindset. What are the elements, not the products, what are the elements that the patient requires to be attended? Let me give you an idea. One time in Veracruz, in one contract, we do a diagnosis about capacity install of the infrastructure of the state of Veracruz, and they had a very bad installations in terms of air conditioning in ORs. Then we include the air conditioning in the OR, and we prorate that cost in between the number of procedures that they require. If we are earning 25 to 42% of the cost, in some cases we can absorb that added value. Then we put all the air conditionings, because it was impossible to operate in that room because of the humidity of the high and the high temperatures. Then when we did that, uh, immediately we could start operating patients. Nothing to be with how to say, uh, we have already in that moment we designed the model of delivery, but the problem was a air conditioning situation. Now then, if you think that you need to put the elements that the patient require to be attended, that's articulation.
Where do you see the biggest opportunity in the healthcare market in Mexico right now?
We should move to the capitation model program. I mean, if we are talking about transplants, for example, we have the 22 centers that produce the 90% of the transplant in the country in our service. We have a very big contract with the government, with the three institutions that really produce more transplants. But we have a problem in terms of education. Mexico, the culture of Mexico is not oriented to donate the organs. No, then we should do something in terms of education, uh, and help the government to promote this health new mindset, to say, if you pass away, donate your organs. No, then we also need to articulate in our chain of supply model the procuration of the organs. No, that means the logistics should be included. The doctors that will take care about the organ, bring the organ as soon as possible, and bring it well. No, and then deliver the organ into the surgery room with everything included. Then we connect at that moment with our actual articulated services, uh, and we produce the surgery, and then we finish the surgery, and we need to connect our service. Now we are only in this part, in transoperatory model. Then I am talking about preoperatory and then postoperatory, and then sign a contract with the state in which the immunosuppressors medicines should be included. No? Then they could pay us per year and evaluate our efficiency of the treatment for that patient every year. No? Then if you include all this in one contract, should be an extraordinary benefit for the population and for the government. They will reduce a lot of costs, because now they are improvisation. They are doing a lot of improvisation because they have a lack of knowledge in how to articulate the chain of supply, the integrated chain of supply. They don't have the software, they don't have the technology, they don't have the knowledge to articulate everything. Then that's a little example in which we can move to the 5.0 5.0 version of articulation.
Can you expand on the Vitalmex plan to leverage its leadership position in the public sector to venture in the private market? And I mean, that's one thing. And the second is how is Vitalmex helping to bridge the gap between the public and private sectors in healthcare in Mexico, but not only, also internationally?
Okay, one of our strategy is diversification. Then, because of that, we invited our new partners, our fund, to have the capital to do some investments outside of Mexico, like Gimme and Surgical Solutions in USA, to replicate our model in that countries. With Gimme, we have access to 65 countries through our distributors. Then one idea is, we could change the mindset of our distributor with the with the storytelling that we have of Vitalmex, some markets. I was covered the market also around the world. For example, Turkey, it's a great opportunity. East Europe is a great opportunity. Greek, with all the problems that have that countries, no, as Mexico. But well, we have put some distributors there that could be thinking the possibility to move to the articulated services. Then when we acquire Gimme, we acquire an installed base of distributors everywhere. Also, we acquired the technology. The technology is amazing. Now we are the leaders in minimal invasive surgery in Mexico. Now we have a lot of towers installed in our country, more than anybody else, and the doctors are using our technology everywhere. Then, and we are not selling equipment; we are using our equipment. No, but we, of course, we buy from Gimme a lot of goods that we require our our model business here in Mexico. The second acquisition is surgical solution. Uh, Most of the market in USA is private market, no, and we already have 30 hospitals in which we are doing private private strategies. And well, surgical solution, we are trying to we are in a turnover situation because we are integrating cultures, and we are integrating now technologies and knowledge between them and us, and we are comparing the we are comparing how we do service articulated service in Mexico, and how can we do service articulated services in USA, and we're learning about them, no, and they are learning about us, and probably in 1 year, 2 years more, the company have an extraordinary potential private market. They could be 10 times Mexico in terms of how to say population of attention. No, then if we go through that private market, we reduce the risk of the country of Mexico country because well, the comparison is that Mexico has 85% of concentration in public market and 15% in private market. And in US, it will be 100%. Then if we deploy the potential of USA in terms of productivity, number of patients attended, well, it could be 20 times bigger than Mexico. Our main objective is to focus in the growth in the USA market because, as I mentioned minutes ago, Mexico has 80% of the turnover concentrated in government and 15% in private market. But the private market in Mexico is very little, no. But still, that we are knocking the door, trying to do articulated services there uh, through three strategies: very personalized solution, iterated articulated services, and as a distributor of many brands, sell products as always. In USA, it will be different because the potential of USA is 4 times bigger than Mexico. Then, if we really invest in that company, we will grow a lot. And after USA, we will try to find another markets in terms of economical space based. For example, India, Turkey, Brazil, Colombia, Peru, Kenya, etc. Big markets, East Europe together. It will be a great possibility. But well, first we need to grow USA 4 times.
But how is Vitamex addressing the deficit in specialized areas, but such as neurology and cardiology?
Creating infrastructure, helping the government to develop and the private market to develop synergies between themselves. As you can imagine, that we can play ping pong in ORs, private ORs in Mexico. No, they are completely. They have a wonderful infrastructure, but they are completely empty of productivity. If we can socialize the private infrastructure, without an state, how say, absorption, it will be a great opportunity to help that kind of surgeries bring up, no, and grow. But there is a lack of surgeons, there is a lack of infrastructure, there is a lack of training, and but we are doing very well. We train around 15,000 surgeons per year, and we are the leaders in cardiovascular, endocardiovascular treatments. Okay, then imagine that we cover all the country, everywhere, with our service, our training. Then we are increasing every year around 30% of capacity installed to attend this kind of patients.
But except, I mean, I want to also get into that because I know it's a really, I mean, you were involved for a really long time in the company, and I also want to hear more like a personal angle, and like what interests me the most at the personal, let's say, experience is like how does your personal experience as the second generation of Vitomex, and like since it was a family owned business, if inform your approach to business leadership. How was it? Can you share some insights about the succession process in a family business based on obviously your personal experience?
Okay, thank you for asking that. It's a very big question. Well, the only thing that I can share with you is that I have a lot of gratitude of what my parents did, because the legacy of this company, it's a very social. It's very social. Even when we are not anymore involved in the operation, Vitalmex is so big, and it's more big than the family, that the Cervantes family. Then we decided together not to have a succession plan to the family, and that was it has a duality. It was sad because every leader wanted to be in front of in a very successful company, and that was sad for me, and it was hard to assume and understand. I passed for very, very difficult moments, but now I can realize that it's one of the best decisions that we can did in terms of family. And then the succession plan was very successful to the new administration. Now we decided to institutionalize the company because we need capital to expand our model of business to other countries, and with our own pocket it would be impossible. Then we sold the 40% of the company, and with the new partners they brought a lot of order. But 10 years before I started working with the team that is now managing the company, the actual CEO Luisa Suarez and her team was working with me for 20 years. Then it's like family. Then the issue is that, well, the company is in a very good hands with a very good talent. The key issue, you asked me, what is the real key issue? Well, the key issue is people, the talent, invest in people, having long-term relationships that really create value together for them and for us. And then after that, well, uh, uh, you will face a very hard decision like this one. Now, of course, I was very excited to be the president of the board or the new control of it. Well, it wasn't possible. My father was strong that time. He wanted to work more years, and he felt very strong. And then, well, the time passed away, and we decided to institutionalize the company. Well, the institutionalization program, it's a very successful one. Our government model is one that we can share to everywhere. It could be a case of a study because it's very well designed with a lot of rules, but with very flexible way of managing. And the board and the management, it's surrounded, or it's how to say, it's filled of very talented people, including us. Well, I am not. I am saying that the Cervantes family, of course, is the founder, and I was working there for 22 years. But now the company, I think, has great potential to be a global company, and probably we can keep a part of our shares, being very proud of that, being a minority shareholders of a big social revolutionary model of business for many countries that really need this product. And that is bigger than my sadness. No, but it's difficult to understand, Jan. You see, if psychologically speaking, well, talking about emotions, it's difficult. But in some cases, you need to do the right thing, even when your emotions are against it. No, that's a philosophy that I have right now.
Right. And the managers, you mentioned you've been working with some for 10 years. And where did you find them? Was it like, how do you, find the top managers that will then lead the company that has grown significantly?
As everybody, some of them are came to knock the door when they finished the university. I'm talking about 25 years ago. No, but the real answer of this this question is you can find good talent on the way. It's not that, well, I will do my research and I will find someone and then I will keep it. You need to give immediately when you invite someone to work with you. You need to give the confidence in all dimensions, and then observe on the way if he's the right person or not. And well, in my case, my leadership style is very humanistic. It's very bonding oriented. No? Then during the years, I create very profound bonds with these talented people, and then we are working now for 25 years together. It's like it's not a family, but it's a kind of family. You see,
But it became a family.
it became a family. We have very hard conversation, very difficult conversation. We have great, successful moments, but we have also difficult conversation, wonderful moments, successful moments, and you need to be patient. You need to enjoy the time together, and and think that the people is not disposable. We have problems inside of us, and you need to manage them.
And of course, it could end like this because Jamie is a fantastic speaker and his thoughts are very interesting. So you will hear the second part of our conversation in 2 weeks in the next episode of Keep IT Healthy App Lovers podcast. See you then, I hope. Stay in touch with us. Subscribe to our podcast, give us a like, comment, or share. If you want to reach out personally, you can find me on LinkedIn and Instagram.